Welcome everybody. This is a video presentation of a PowerPoint and training that Delmarva provided to 6 regional parts of the state. The topic that we're going to be covering is quality assurance and documentation. My name is Teresa Skidmore. I'm one of the regional managers with Delmarva. And joining me will be Kristen Allen, one of my fellow managers, and she'll be coming in and presenting some of the information for you today. To get started, first off, just to give you an overview of what the purpose of the training is, we are going to go over and describe the discovery process. As you know, Delmarva has a contract here in Florida doing quality assurance, and the part that we cover is discovery. We do 2 types of reviews, person-centered reviews and provider discovery reviews. Person-centered reviews we often refer to as PCRs. Provider discovery review we often refer to as a PDR. And ultimately what we want to do is describe documentation required for service delivery and billing, and answer any questions that you may have had about our process. The purpose of the quality assurance contract. To evaluate the effectiveness of every provider involved in the life of a person who's receiving services. To measure the efficiency and the efficacy of the HCBS waiver system. How well is the system working? Is it doing what we need it to do? And to help ensure the person is involved in the support plan and providers follow the support plan as it's written. Overall, those are the purpose of our contract and how we set up our review tools. The discovery process itself, for the services that we review, these are the services that Delmarva reviews: adult day training, behavior analysis, behavior assistant, companion, in-home support, personal care assistance, residential habilitation, respite, specialized medical home care, support coordination, supported employment, and supported living coaching. If you render any of these services, you are subject to a review, a provider discovery review that Delmarva would conduct with you on site, in your home or in your office, wherever you keep your records for the services that you render. To start off, the person-centered review process is what I'll be going over with you. Part of my role as a regional manager is I take a lead over the person-centered review activities. Person-centered reviews assess the support delivery system from the perspective of persons who are receiving services, persons with disabilities. The intent of the PCR is to evaluate, sorry about that, let me go back to the PCR. The purpose of the PCR is to evaluate all the services that a person is receiving. Through a conversation with the person who's receiving the services and a review of all their service providers, we can get a picture as to how well services are working for the person. In a couple of slides, I'll be going over with some of the detailed information about a person-centered review and what's included in a PCR. However, before we can cover to that, I do have to go over with you something called our non-compliant procedures. As I mentioned, Delmarva has a quality assurance contract. Our contract is held with AHCA, the Agency for Healthcare Administration, and with them we also work with the Agency for Persons with Disabilities. Part of that is we are charged with reviewing every provider in the state who renders services to people and bills for those services. Part of that process involves us contacting providers and scheduling their reviews. The process is mandatory. It's not something that providers can opt to participate in or decide not to participate in. If you signed a Medicaid waiver services agreement and you're billing for services in Florida, you have to comply with receiving a quality assurance review, which in this case is a provider discovery review. Our reviewers conduct close to, I want to say we're targeting about 3,000 PDRs in a given year, and along with that, person-centered reviews. So the scheduling process takes quite a bit of time, and their calendars get filled fast. So when we are trying to contact providers, we are going with contact information that we got in the system, a phone number, an address, something that we're trying to contact providers. Non-compliant procedures were set up as a means to put consequences in place for providers who choose either not to return our calls, refuse to make records available, or who don't show up for appointments as scheduled. The non-compliant procedures are available as one of the handouts. They're posted in our policies and procedures, and they're posted on our website. They are specially designed really to fit those circumstances where a provider really does not return any of our efforts to contact them and hasn't kept their contact information updated in the system or with their area office. So when a reviewer is trying to get a hold of a provider, they're first going to use the phone numbers that they have in the system. If they are unable to reach a provider, they're going to contact the local area office and have that area office assist them with trying to track down the provider. The area office will typically try other phone numbers that they may have. It may ultimately send out a letter, possibly a certified letter, letting the provider know that Delmarva is trying to conduct a review with them and to call us immediately. We have certain time frames in place that we follow, but if after at least 2 attempts, and it really is at least 2 attempts, and after we go through all our procedures, we are unable to conduct a review with you because we cannot find you, we will actually do the review without you. And that basically means that we will conduct the review, score all the elements as a not met, and it really results in you scoring a 0% for your review. So the real message is return the phone calls. If you see Delmarva call and you're here, that we're looking for you. If you choose not to make records available, and you decide that you don't want Delmarva looking at your paperwork, again, your choice, but Delmarva will conduct the review and you'll be scored not met for all the standards involved for the services that you're rendering. Lastly, if you're a no-show after a review has been scheduled, and this is really when you were legitimately did not show up for a review. In extenuating circumstances, an emergency or something like that, on a case-by-case basis, of course, Delmarva works with providers to settle that. This is really defining those providers who just decide not to show up after a review has been scheduled. Again, the result, if you're found non-compliant, is your score not met on all standards of the review. A report is completed, it is sent to you, and it is posted for ACA and APD on their website to review. Okay. So let's go back to person-centered reviews. The person-centered review uses a number of tools in our conversation with people who are receiving services. One of the tools that we use is the National Core Indicators Adult Consumer Survey. The NCI, National Core Indicator, is a survey being used by 29 states to gather information and data about the lives of people with developmental and intellectual disabilities. It is a survey designed by and developed by a company called Human Services Research Institute, HSRI. Delmarva is simply the agency or the individuals, the reviewers with Delmarva are the ones who are administering that survey. When when APD signed on for a new contract with Quality Assurance and made some changes in their system, one of the things they decided to do was to have National Core Indicator surveys being used in Florida to gather information on the quality of services. It made sense at that time to have Delmarva, who was already going out and talking with individuals getting services, to administer the survey. A little information about the, thought there was another slide. A little information about the survey itself. It is very much a survey. The questions are designed where the reviewer asks set questions right from the survey itself. It is broken out into 2 sections. The first section of the survey, when a reviewer is asking the questions can only be answered by the person who is receiving the services. Now, in some instances, there are some individuals with certain disabilities, pervasive disabilities, that sometimes impact their ability to use words. At that point, we would look to develop or understand what is that person's means of communication. If we know ahead of time, and we often are contacting the support coordinator to arrange the person-centered review, we're trying to figure out what is that person's means of communication. Do they use sign language? Do they use gestures? Who are the people that know that person best? When doing the NCI survey for Section 1, the reviewer has to get the answers from the person who's receiving the services. They have set codes within the questionnaire that they can answer, and one of those codes could be that the person is unable to respond or unable to answer. They would go through each of the questions in Section 1. If for some reason, dependent on the disability or communication style, the person cannot provide information in Section 1, there is Section 2 of the survey. In Section 2 of the survey, it allows other people who know that person well to help contribute and answer questions on the person's behalf. Important things to keep in mind with the NCI survey, it is just that, a survey. The questions tend to be close-ended. We're asking questions about, do you go to church? If you do, who takes you? Who drives you? How often do you go? Do you go shopping? Who takes you shopping? How often? How many times a month? The questions can be very specific and can be very detailed, and the reviewer really has to stick with the survey questions as written. They can't really go off the map. So they follow the survey, they go through all those questions, and it is a separate and distinct part of the person-centered review. When the reviewer completes the NCI, the National Core Indicator Survey, they will let you, the person and the family or whoever is present for the interview, know that they've completed the NCI portion of the review. So the NCI is one tool that's being used. The individual interview instrument is another tool that Delmarva uses in order to gather information and talk with people who are receiving services. This is a tool that Delmarva developed. We've been working with it in our services and our program reviews that we do in Georgia. And when we started this new contract here in Florida, we brought the I-Cubed here. The intent of the I-Cubed, which is Individual Interview Instrument, is to capture information from the perspective of the person regarding their desired goals, outcomes, and satisfaction with services, and to determine whether services are being effectively implemented according to the person's needs and preferences. Essentially, it's getting at the heart of what is going well for the person, what do they like about their services, what's working for them. We break it out into about 12 different, there are 12 different standards, I believe, in the I-Cubed, and the questions are open-ended, they're conversational. It's a little bit different from the NCI survey. At this point in the process, the reviewer is able to ask questions and kind of gather information from different perspectives, from anybody who can contribute that information. One more thing to go back to the individual interview instrument. The information that's gathered from the I-Cube does get reflected in a person-centered review report. The reviewer will make determinations based on those 12 standards, I believe it is. Is it a yes or is it a no? They could have decisions related to a person's services, rights, community involvement. How well are they involved in the development of their support plan and choosing their goals, in assessing how progress is going with their services. It really is looking at, from beginning to end, the individual's involvement in their service delivery and how providers are supporting them. So this part of the conversation, this part of a person-centered review, does get reflected in the report. What I'd like to point out is with the National Core Indicator Survey, that survey is completely confidential. Any of the information or the data collected in that survey is simply coded just to that, for data. It never attaches to a person's name or reflects specifically for that person. What Florida will be able to do with all the NCI surveys that are conducted is all that survey will be able to be gathered up and compared to other states who are asking the exact same questions of people with disabilities. This will allow Florida to make some comparisons on how services and the lives of people with disabilities are compared to people maybe living in Washington State, in Massachusetts, or other places around the country. So by having the same questions asked in the same guidelines by reviewers who are trained to administer the survey, you can have the ability to compare apples to apples. The I-Cubed is a questionnaire, but it's intended to be conversational, open-ended questions. We do use this information in the person-centered review report, and it helps kind of paint a picture for how the service system is supporting the person. The last tool when we're conducting a person-centered review, so when we schedule one of these PCRs, we contact the support coordinator, and they make the initial contact with the person or the family member, because they're not going to know a reviewer from Delmarva, but they will know a support coordinator, hopefully. At that point, the support coordinator will let them know that this person's been selected for a person-centered review, and will ask if you're willing to participate. One important thing that I failed to mention before is that a person-centered review is optional. You as an individual receiving services, or as a family member with a person receiving services, has the option to participate or not participate. We conduct a sample statewide. Roughly 2 individuals are drawn from every support coordinator's caseload around the state. In year 1 of our contract, we conducted approximately 1,600 person-centered reviews around the state. At that point, when we're doing the survey, if you choose not to participate and decline, we would go to another randomly selected name off of that support coordinator's caseload. So how you get pulled into a PCR is random. We do a scientific sample at the start of each year. We did one for year 1, and we're just now finished our PCR sample for year 2. When the support coordinator comes up for their review is typically when you're contacted for your person-centered review. The tools that I've been talking about with a PCR is the National Core Indicator Survey, the I-Cubed I just went over, and this last one is the Health and Behavioral Assessment. This is the third